And the first one coming up to the stage is Vili Kostamo, a medical doctor and CEO at MedicubeX, building autonomous health kiosks that allows people to check their vital signs and risk factors in just minutes. Please join me in welcoming Vili to the stage.
Okay, so I'm Vili Kostamo, CEO and co-founder of MedicubeX, a medical doctor by training, and today I'm here to talk to you about the impact of usability on adoption of medical technology, also both from the organizational perspective, but also from the perspective of individual users. So basically aiming for the lowest possible barrier of entry, both as a business case and from a usability standpoint. So which problem am I solving specifically? I will be very much using our product as an example because that's the thing I know, but I will also try to generalize as much as possible. So I am solving two problems, interconnected problems. So we have a huge number of lifestyle-related diseases, a huge number of lifestyle-mediated disease-related deaths in the Western world, also nowadays more and more on the global stage as well. And for whatever reason, our current healthcare system is not able to prevent problems that are on a medical level easily preventable. So we should try to do something about that. And at the same time, we are running out of healthcare staff. Everybody knows how our population pyramids look like. The ratio of elderly people to working age people or even children is rising rapidly, and it will continue to do so. So whatever we do, it must not rely on the number of able-bodied people willing to work in healthcare. All right, so now we know what we are working with. And then what? What does our, in this case, MedicubeX, what does our customer need? Well, if only there would be a way to prevent these horrible cascading problems from leading to disability, high costs, high workload, and death. Okay, well, it's not exactly easy to do that, but let's try. So I have a 500-kilo SaaS solution. You might call it station as a service, perhaps. This is foreshadowing for the business modeling part. But basically, what we offer on a conceptual level is access to prevention, access to information critical for preventive healthcare actions. Cardiovascular disease risks, metabolic risks, mainly type 2 diabetes, while at the same time not increasing the workload, but rather decreasing the workload of healthcare professionals, which we are running out of, as mentioned. So then what does our customer actually need? And I don't mean the stuff they tell me. This is the stuff that I know they need. So before we get to any actual impact, you need adoption. You need to make the service achievable, approachable, purchasable also. So all right, before you can have an impact, somebody needs to use your stuff. So that's number one. It has to be low maintenance. So as said, we are running out of people. We cannot increase repetitive maintenance tasks. And also, we need to then, on the third step, we need to actually solve the problem they had in the first place. And then I think almost equally as important is my point number 4. Don't create new problems. Everybody can walk into a full-body MRI, and for 300 euros or so, you can get a full-body report of everything that might be wrong, but you can't really be sure, and then you need to follow up on it every year after, and everybody gets pissed. Like if you call your GP and tell them that you did 100 different tests and 3 of them are in the red, they will be at least as red as the ink on the result sheet. So that's not good. So, okay, how do we make this approachable from the organizational perspective? So we have opted for a service model. We offer a 500-kilo hardware solution as a service. basically a turnkey thing, maintenance, updates, security, everything, all included. There's no capital expenses. You just pay for what you need, and you have it. If you don't need it, you just ditch it. We pick it up, and end of story. So basically, we are doing business with businesses and public sector organizations. So easy to adopt. If you don't want it anymore, you just call us and we pick it up and you never see us again. Well, rarely happens. People tend to be quite happy, but it's a thing. So this also enables us to iterate fast because we own our hardware. We can do things with it. We can update it. We can maintain it easily. We don't need to call them and ask them, hey, can I come and change out the light bulb? Just do it. Okay, so then what does our end user need? The individual patient or the individual clinician or nurse or whoever we perceive as the end user. So it has to be easy. Nobody wants to do complex stuff unless you absolutely have to. And as we already know, and we have established in the very beginning, that prevention does not happen by itself. We have chronically failed at doing prevention. So whatever we want to do to this problem has to be easier than the old methods. Has to be super easy. Well, now also, this is a sensitive topic, as I also mentioned. Our most common, deadliest, most expensive chronic conditions are lifestyle related. So this is a sensitive topic. People do not want to feel like they are being judged. People don't want to feel like somebody else might know about their concerns or any insecurities or worries they might have. Might have had a relative who has gotten sick or something. Like this is a very sensitive topic, even for people who might generally be very open about more or less anything else in their life. And then again, I would argue only after crossing all of these thresholds, then do we get to solve the original problem. So now, at this point, now I'm showing you the physical product we have built. So basically, what we have designed and what we have built is a fully autonomous self-service station for health checkups. More or less all non-invasive cardiovascular disease risk factors can be measured there by an untrained person in 5 to 6 minutes. We have more things on the way. For example, we have signed an exclusive agreement with an UK-based company for adopting their AI-powered stethoscope, which will enable us to do even more. But we are already the most comprehensive self-service health measurement thing on the planet. And we will be, let's say, stealing that crown from ourselves with the next iteration. Also, the system itself automatically disinfects with UVC lights. Has all of the safety features, all of the gizmos required to do that. So it can run for months with just regular basic cleaning. As long as somebody vacuums the rugs and takes out the fingerprints from the touchscreen, it can run for 6 months, for example, without any intervention. And even if we need it, we can do it over there, since they're always online. So then what do we do with it? So we have several different use cases, all the way from emergency rooms, urgent care, triage, to specific health checkups, for example, in the workplace, or also sponsored by the public sector for unemployed people who don't have access to occupational healthcare services. So one physical hardware product, multiple different use cases, multiple different service concepts, and they all have this shared idea of helping the healthcare system take care of you without increasing the headcount. And so then maybe, okay, now I have a product in a category nobody has heard of, and I have a business model that nobody has heard of. So how do I actually sell this thing? So obviously, it's very important to identify who needs it and who can pay for it. This varies country by country a lot. And also, since this is something nobody has heard of before, you also need to really convince the buyer that this is a solution to a problem you know you have, but you haven't really thought about doing anything about it. Since traditionally, like, nobody has funds for prevention. Well, luckily now we actually have. So, for example, in Finland, our public sector has this specific structure to paying for prevention. It's called hytekerroin. And also, it's very important to state that what is it? Well, it's a medical system certified and brought to the market by us in the EU, in the UK, and it's under the MDR, but it's technically not a medical device. So many people are scratching their heads, but this is quite relevant. And of course, also expectations management is really important. So it will not treat you. It will not, hear all your worries, but it does take care of the important stuff that nobody usually has time for. And so then a very brief look back into our history. So we have had the very first unit in use with the City of Helsinki Health Services a bit more than 2.5 years ago. And already back then, the user experience was very nice. A lot of people liked it. A lot of people found it easy to use. And since then, the overall concept has remained very similar. So many of the same things can be found there. There's some added functionality, but it seems like we got quite a lot of down already in the first stage. The version on the right is already in serial manufacturing with Innokas Medical, and it's shipping also, not just to Finland, but also to Germany and the UK, for example. We have already signed customers, we have already made deliveries. And if we have extra time, which I doubt, we can also try and do this find 7 differences kind of quiz to what has changed and why. But anyhow, so rapid internationalization, rapid growth, new type of a product, new type of a service, and just a few examples of what do we actually do with this. So for example, Terveystalo, our strategic partner, has already deployed their first unit into the Olkiluoto nuclear power plant for use specifically in preventive health checkups by employees. Simultaneously, we delivered a unit in May to the Frankfurt University Hospital, who is offering preventive health checkups to the general population, who can then, based on their findings, directly book a consultation at the university hospital. Okay, checkups, university hospital, general population, Terveystalo, employees. So very different models, similar concept. Now, for example, in the UK, we have a unit that's available for subscribers to a gym, more or less. It's also, it's actually operated by GP practice, so it's still definitely medical use. But then again, UK, gym, general population. So very different approaches, but the hardware is the same and the aim is the same. And now, on 15th of October, we signed a contract with Istekki, and now the e-health station is available to 15 well-being services counties in Finland through this contract. So we are very much now at the stage where this is no longer some garage thing that a few people somewhere are working on, but we have actually demonstrated that the product works, the model works, and I expect very rapid adoption in the next few years, both in Finland and also in the rest of Europe. So, and a little side note, okay, who else is doing health checkups for people? Well, DigiFinland has the Oma Olo service, which also, by the way, works there. So right now, in Helsinki and Oulu, it is possible to also do that in the booth. So we are also connecting with other people, other organizations, to provide better service. But yeah, so that was it. Thank you for your attention. Also, just in case somebody is interested, we are actually fundraising right now, and there's a QR code to the Springvest platform that you can use for that purpose. Thank you.
Thank you so much, Vili.